The volume of pulse is actually assessed by taking blood pressure, right? Not by palpating, but by taking blood pressure. So what you find out is the pulse pressure. Pulse pressure is systolic blood pressure minus diastolic blood pressure, and the normal pulse pressure is within the range of 30 to 60 mm of Hg. 30 to 60 mm of Hg. So what is the abnormality in the volume of pulse? Number 1, if the pulse pressure is less than 30 mm of Hg, then it is a low volume pulse or a hypokinetic pulse or a pulsus minimus. Similarly, if the pulse pressure is greater than 60 mm of Hg, then the type of pulse is a high volume pulse or a hyperkinetic pulse or pulsus magnus. First, low volume pulse. The cause of low volume pulse is low output state, and the low output states are number 1, congestive cardiac failure. So if the heart fails to pump properly, it is unable to pump out enough volume of blood, so you get a low volume pulse. Number 2, when the volume itself is low due to dehydration or due to cardiogenic shock or due to hypovolemic shock. In these 3 cases, that is dehydration, cardiogenic shock and hypovolemic shock, you also get what is known as a thready pulse. Thready pulse is characterized by low volume and high pulse rate. If low volume pulse is as a result of low output states, then high volume pulse is as a result of high output states. And guess what? I've already asked you to mog up all the high output states under the topic of pathological causes of tachycardia. So tell me, fatafat. Number 1, fever. Number 2, pregnancy. Number 3, anemia. Number 4, thyrotoxicosis. Number 5, beriberi. Number 6, liver cirrhosis. Number 7, Paget's disease of bone. And number 8, atriovenous fistula. Okay. Low volume pulse is also caused by stenotic lesion of the valve, because in stenotic lesion of the valve becomes narrow. As a result, low volume of pulse passes through it. This low volume of blood passes through it. For example, in mitral stenosis, less blood reaches the left ventricle, so less blood gets pumped out and you get a low volume pulse. In aortic stenosis, less blood gets pumped out of the left ventricle, so you get a low volume pulse. On the other hand, high volume pulse is seen in regurgitant lesion of the valve, like mitral regurgitation and aortic regurgitation, because the regurgitant lesions, they result in volume overload, and if there is volume overload, it will eventually lead to high volume pulse. So low volume pulse is seen in low output states, high volume pulse is seen in high output states. Low volume pulse is seen in stenotic lesions of valve like mitral stenosis and aortic stenosis, while high volume pulse is seen in regurgitant lesion of valve like aortic regurgitation and mitral regurgitation. And with that, we are done with the volume of pulse as well.